Hi class, my name is Julie Hughes and I chose the coronavirus as my topic due to the current pandemic that we're currently facing. I'm sure that many others probably did this. I'm about to review other PowerPoints, but since many of us as nurses are working on the front lines of this disease, I wanted to educate myself further, so that's why I chose the coronavirus. I also included in my PowerPoint a quote by Mahatma Gandhi. It is health that is real wealth and not pieces of gold and silver. And I think that speaks for itself um, and makes us understand what's important in life. And my objectives in my PowerPoint is to find the coronavirus pandemic versus epidemic, statistical information, comparison to other pandemics, demographics, the impact of the coronavirus, prevention measures, activities to enhance all levels of prevention, screening tests and costs for patients, benefits versus harm related to the screening process. There's a picture of the coronavirus. As you can see, it has spikes, and the word corona comes from crown. And if you look at it, if you cut it in half, look at it, it does look like a crown. What is the coronavirus? The coronavirus is a family of viruses that can cause illnesses such as the common cold, severe acute respiratory syndrome, known as SARS, and Middle East respiratory syndrome, MERS. In 2019, a new coronavirus was identified as the cause of a disease outbreak in China and is now known as the pandemic COVID-19. Why is the coronavirus a pandemic? It's a pandemic because it affects a wider area, sometimes worldwide, and in this case, it's definitely worldwide. It affects a larger number of people. Most often, it is caused by a new virus or new strain of the virus, and humans have little or no immunity against the virus. It causes increased deaths and often creates social disruption and economic loss. And as you can tell through this pandemic, all of those apply. An epidemic is the rise in the number of cases of a disease more than what's expected within a particular area. How is the coronavirus affecting us? I have updated this every day. I've been working on this for 2 weeks. Today, there are more than 1 million cases worldwide with 54,000 deaths worldwide. The United States, their total cases are 245,000 with over 6,000 total deaths. The other pandemics that the world has experienced is a little over 10 years ago was the H1N1 known as the swine flu, which affected 1.4 billion people globally and killed more than 500,000 people. That was only secondary to the 1918 Spanish flu. The countries most affected last week, China and Italy were on top of the list. Now the United States leads the list. Global implications. I included this. I wish I would have updated this as well, but as you can see, everything that's in the blue are the countries which are affected. The new map shows all countries are almost completely blue. Some ways a pandemic can change the world. I thought this was interesting because it does list. I just listed 6 of the ways it can change the world. There were many more, but I thought these hit home and were more applicable to the current situation. The personal becomes dangerous, and that means the comfort of being with others is replaced by a greater comfort of absence. A new kind of patriotism, as we're seeing many uh, people of the communities are honoring nurses and doctors and healthcare workers, and that is something totally different and away from government. A decline in polarization. People will begin to look past their differences when faced with a shared external threat. A return to faith. People are forced back to accepting that expertise matters as Americans in return for what really matters. Less individualism. People could turn towards authoritarianism, such as people feel less in control. And a new reform. People rely more on the government. Now I'm going to talk about prevention. The number one prevention, not only for the coronavirus, but as nurses for any virus, any bacteria, is wash your hands. Wash your hands for at least 20 seconds. That's the number one defense. Disinfect, cover coughs and sneezes, stay at home, wear a face mask, and avoid large crowds, which we're all practicing right now. Activities to enhance prevention. I just discussed most of these, but another huge issue is avoid touching eyes, nose, and mouth. How coronavirus has impacted the world. It's definitely impacted the economy. As we all know, we're in a recession. It has slowed global growth, initiating a global financial crisis. Travel, of course, all the airlines and are suffering. Politics, governments have uncoordinated country-specific responses to the virus. Screening test. Do you have symptoms? Some of the symptoms include loss of taste and smell, shortness of breath, fever, cough, even some GI symptoms such as nausea and vomiting. If you have any of those symptoms, you should get a COVID-19 test, and that is performed by swabbing the back of the nose, go down deep. We have had some false negatives in the unit from just swabbing the nose, and once we sent bronchial secretions to the lab, the test come back positive. So it's very important to do this test and go down far through the nasal passage. How much does COVID-19 screenings cost? I think most insurances are covering most of the cost. There were I found different articles on the cost, but from what I saw was anywhere from $35 to $91 to $51.31 per test. The most important benefit to early detection is the obvious, that allows the person the opportunity to quarantine from others, which in turn decreases the spread of the disease. And I already talked about the false negative result, which can be detrimental. The person thinks they're negative and they're actually positive. And these are my references. Of course, I got most of my information from the CDC. However, the Mayo Clinic was very informative, and got some of my financial information from the Medicare administrative site. And that is all, class. And thank you. And I look forward to reading all of your PowerPoints at this point. And have a good evening.